You know, we can do more than just stand up quickly. Can everybody hear me? Because he's busy. No. Okay, all right. I have to develop a bigger voice. Okay, so what I'm saying is that the idea is not just to stand up for a moment. The idea is to kind of flex yourself. This is what I get from my friends over at the American College. So I hope that it can extend this, 5 seconds into 10 or 15. Whoa, big time. And as you may know, we're going to have a walking tour after all this is over, so it'll give you another opportunity, assuming that the weather's going to support that, to kind of do the same thing. So we got two things going on at once. We're going to get our brains a little bit massaged and our bodies as well. Okay, so here we go. We're going to join then the second session, which will include Bill Walsh, who is the Executive Director, Healthy Building Network. Before I really get into that, I want to explain what we're trying to do with this first session, so I don't save it all at the end and surprise you about what you were supposed to hear. And that is that the first part of the session was to deal with the history. The second part of it is, since this is, as we very speak, some applications. Bill was selected and Lisa to talk on this one. Bill coming at it from kind of a legal background, right? And he'll talk to you about the network program that he has established. And Lisa will talk to you, being a medical doctor, about the environmental medicine side of it. So we're kind of enjoining these realities and how they actually work. Not something out in the future, but something that's been going on right now, is happening right now. So getting back to Bill, he's the Executive Director of Healthy Building Network, holds a JD from Northeastern University of Law, and an LLM in Public Interest Advocacy from Georgetown University. And the second speaker will be Dr. Lisa Nagy. Yes, I say it right? It's a tough one because it's spelled differently. She's been a HiBR member pretty much from the get-go, huh? Yeah. And president of the Preventive and Environmental Health Alliance. Lisa has had extensive experience both personally and as a private practitioner in the area of environmental medicine, which she will share with you as the time will allow. And we say that because she knows Lisa could really do this whole thing all by herself. All of us probably could. And she has the passion to want to do that. So we're going to have to pay close attention to the time. Bill, we'll start with you.
Do you want me to go? I was starting to go.
I think she's ahead of me, right? Yes.
Yes, keep the plan.
Okay. I could look like Bill. Okay. Which button do I not press? Just this one. Got it.
Yeah, consumed by the technology.
We get a little extra time, and one person wasn't able to make it, so I have 2 minutes more. Okay, I made a note of something I wanted to say before I start speaking about my talk. It's been a very good month for me. 10 days ago, I was asked to speak in New York City as a keynote speaker, and I was well received on the remediation and problems after Superstorm Sandy with the buildings, the water damage, the absence of removal of wet drywall and wet cabling, and then putting in drywall and materials to a wet building that hadn't been dried out enough. And then they're having problems, and they wanted to discuss those problems, and it was an overwhelming response. The Commissioner of Buildings was the other keynote, and he may be here today or have sent somebody. So I appreciate that New York City is interested in moving forward and learning about health effects of mold and environmental medicine, both. I changed the title 15 times, and there's so many titles I just added 3 here. So I'm going to give you a little bit of information about the history of environmental medicine, the truth about the health effects of mold, and how prevention will save healthcare billions. Just a modest attempt to cover it all. So my name is Lisa Nagy, and I'm honored to be invited here to speak about the health concerns in buildings. I'm on the board of directors of the American Academy of Environmental Medicine, as well as a member of the Roundtable today. And it feels great to come back to DC because I went to Madeira and I grew up here. And I used to work on Capitol Hill in 1977. And I feel like I learned the skills in those two places that are helpful to me now to advocate for the environmentally ill who are too sick to communicate their views about the utmost importance of environmental health. I learned about toxicity in the home the hard way. Back in medical school at Cornell, I never would have guessed that my interest would have changed from emergency medicine to environmental medicine. You have to experience the hell of becoming environmentally ill to appreciate the horror and reality of the condition, to tell you the truth. I can describe at another time my experience developing severe mitochondrial damage, Addison's disease, chemical sensitivity, and what looked like Lou Gehrig's about 10 years ago. My husband and dog also suffered the same consequences from a moldy aquarium attached to my home. The fact that habitats we live in and work in determine our health was first published by Randolph and colleagues 70 years ago. We're actually rediscovering the wheel, as it were, and our government agencies and medical societies should study from those who are way ahead of their time in this field and are still alive, some of them. The origin of health in buildings began in 1950 with the field which is now called environmental medicine and was clinical ecology back then. Wrinkle M36 described food allergy, hidden food allergy, and the relationship to headaches and eczema, and said that if you rotated your foods on a 4-day rotation, you would lessen the burden to the immune system and not become allergic to food. Don't eat the same thing for breakfast every day. Randolph, in the 50s through the 80s, continued his work and described that individuals exposed to chemicals and also indoor toxic molds soon become intolerant of other chemicals and foods and can develop environmental illness or chemical sensitivity. Dr. William Ray is treated by Randolph for pesticide exposure 30 years ago. And then he has subsequently treated 30,000 people with Gulf War syndrome and sick building syndrome, chronic fatigue, fibromyalgia, and chemical sensitivity, all conditions proven to be related on spinal fluid analysis and brain scanning by Dr. Baraniuk at Georgetown. Bill Ray states that mold is now the cause of 70% of environmental illness in the patients he sees. This is a diagram of pollutant overload with the damage to the autonomic nervous system on one side and the endocrine and immune system on the other, and below the damage to blood vessels and the leaking of red cells and white cells and cytokines out of the capillaries. Some stunning articles that I came across in the last week. EPA said that 30 million homes are making people sick from mold, radon, and other exposures. This is the first statement I've heard of EPA on the health effects of mold that is not just respiratory. 40% of homes and schools have previously been reported to have problems with toxic mold. There's a 40% depression rate if mold is found in your home. 3,000 people were questioned. The neurocognitive dysfunction that is prevalent in these patients is dramatic. They can't find their car in a parking lot. They can't remember how to drive to the office. They can't remember what they just read. And I couldn't read for 3 years when I became ill. This is a stunning article on housing renovation and decoration when you're pregnant or 3 months before, that it can cause cardiac malformations, and this came out within a month ago. Environmental illness is ubiquitous. I've learned that we're on a continuum from 1 to 10 of being affected by our environment, and nobody is a 0. It's how you deal with exposures that determines how environmentally ill you are. It's not common. It is common. Doctors should look for it in everyone. Many of your spouses or patients or parents, either one, parents or patients, may have symptoms, and many people in this audience will be mildly chemically sensitive. It's really in 70% of women over 40, and it's less so than men. The ratio is 4 to 1 women to men. Often, because it's in women, they're called hysterical, they're given anti-anxiety medication, bipolar medication, and they're referred to a psychiatrist. But actually, many poisonings we know of have psychiatric manifestations. So having a psych appearance doesn't mean you don't have a physiologic basis for your problem. So high thyroid or mercury poisoning or many other exposures can lead to psychiatric issues. Here are the signs and symptoms in a nutshell of being a little chemically sensitive. You don't like perfume, diesel exhaust, detergent aisle of the grocery store. You can be tired, have muscle weakness, memory loss, and talk really quickly like I am right now. Clothing tags can itch the back of your neck. Your bra can feel so tight you cannot wear one for years because you don't have enough oxygen in the tissues to perfuse. You can have anxiety, hyperactivity, headaches to exposures like magazines, nuts, red wine, the mall, and tire stores are particularly troublesome. You cannot fly without having panic because there's jet fuel, close quarters, and lots of people with perfume and magazines on the plane. How would we save billions in healthcare costs and disability? What we learn from the severely environmentally ill can be applied to all of us in staying healthy as possible, hence building buildings that keep us healthy. It is possible to get to the cause of disease by detoxifying people and stopping certain exposures. This approach really applies to autism, also to many cases of Parkinsonism, MS, Lou Gehrig's, and especially the inflammatory conditions like cardiovascular disease and diabetes, which are rampant and costing us a fortune to maintain a sick society. Many autoimmune diseases have links and triggers that are in the environment as well. If you understand this history, you can appreciate the need for the future change in our approach to health and buildings from now on. There is a pressing need to prevent and reverse diseases of the modern era, which will make environmental medicine the guiding light in this century, I do hope. 5% of the population is disabled from chemical sensitivity. 15% have symptoms of chemical sensitivity. 40% of the population have mild symptoms but do not realize it's related to chemical exposure. So that's many millions of people. Social Security acknowledges it's a disability, yet doctors deny it. They were not taught it in school. It's very hard to teach an old dog new tricks, whether it be a doctor or anybody else. And we had discussed these issues of the medical field is trailing behind the public demands for answers about things like mold and mycotoxins, pesticides, furniture leaching chemicals into the air, and especially EMF, electromagnetic frequencies from wiring, from Wi-Fi, from smart meters and transformers is the next big issue in building. So we must not leave this out. Who would want to be sitting at a desk with the wires for the building or the floor running right behind your chair? It will make you feel ill. It'll affect your autonomic nervous system and your heart. But really, do doctors know enough? And there's plenty of data, but we need to get them to look at the data. Here's a person who had mold-induced skin autoimmunity, which was life-threatening. The one brilliant article that I want to discuss very quickly is that the Army does research on mycotoxins, and in 1988, they published a study on rats breathing in moldy air. They developed adrenal necrosis and died, but only the female rats. Later, Thurman gave injections of testosterone to the female rats, and they survived. So the adrenal failure is being mitigated by borrowing testosterone. This is why men in a moldy building do so well and women do so poorly, and they often, in the human version, not the rat version, divorce and cannot tolerate each other's sensitivities. Mycotoxins have been noted this week in a new article in 93% of chronic fatigue patients. So the treatment, I don't have time to discuss it, but get away from the exposure, reduce your total load in air, food, and water, no plastic bottles, no products with scent or chemicals, no pesticides, have an Oasis bedroom, IV vitamins so the liver can detoxify, replace hormones and nutritional deficiencies, carefully do sauna to get the toxins out, charcoal and cholestyramine to bind the toxins, oxygen therapy to fix the blood vessels, allergy testing called provocation and neutralization, and boost the immune system. The CDC's National Conversation on Chemicals and Public Health did say we need a facility to treat these people and do research on all of these conditions that is non-toxic. It also said that the impact on mothers who are exposed to mold may lead insights to autism. And don't we need to look at that now at some point and use some cutting-edge methodology and learn from people who have come before? This book by Paula Baker Laporte is brilliant. Everybody should buy it who builds or does architecture. It's called Prescriptions for a Healthy House. I am a resource. The American Academy of Environmental Medicine is a resource. And I have a website and a flyer that has the website on it, on the chairs and the exits of the room. If you go to the website lisanagy.com, you can look at a University of Pennsylvania medical lecture on the whole field of environmental medicine that slowly goes through all the principles I described in the last 5 minutes. Thank you so much.